Thank you. I have one for Nikki up here. Oh, you want to say something? Go ahead.
Also, tagging on to that, other things could affect the bowel as well. For instance, if you have a high intake of sugar alcohols, they will pull fluid into the GI tract and could cause diarrhea. Caffeine could be a stimulant causing diarrhea. And the other thing that I would kind of wonder about is your omega-3 intake. Omega-3s, lots of research has been done to help, or in their effects, to decrease the inflammatory response. And that could all be something that could be playing into this.
That equals food logs.
Yeah, just to add on to what Lance talked about, just because he talked about the food. Fiber is again an important constituent of this whole package, because if your fiber intake is not adequate, as can happen, because you go in your stomach or your intake is restricted, and then you start with the protein and your veggies and all that, and eventually it may so turn out that you're just not getting your recommended daily intake of fiber. Depending on your age and sex, typically it's around 35 grams of fiber a day that you need, and the statistics show us that only 8% of all US adults actually get their recommended daily intake of fiber. So there are quite a few things to look at.
Anybody else want to jump on this one? I'm sorry. Nikki, there was a question about what is your favorite protein shake out of your lovely book that everybody has. So Megan and I can try.
I think I go through phases. Some of them are seasonal. So like, during the, this year was the first year I didn't do heavy with the pumpkin because the food industry seemed to pumpkin all of the things this year. So I like to buck the trend, so I stayed away from the pumpkin this fall. But in the fall, lots of times I'll make a pumpkin pie shake and things like that. My absolute favorite protein shake is actually just really a simple sort of mocha. And that was what I started out with. That was the very first shake that anybody had ever made for me that I didn't think was disgusting. Was that we combined a chocolate shake with a little bit of unsweetened cocoa and a little bit of really good decaf, instant espresso, and blended it together. And it was really, really good because I don't know about you all, but whatever my surgeon did to my stomach, I don't like super duper duper sweet things. So the coffee and the bitterness of the coffee offset some of that sweetness a little bit, and it was really, really tolerable. So to this day, I really do just like a really simple mocha protein shake and just grab it and go.
You just broke Megan's heart. Because she is pumpkin spice girl right next to you. Go ahead and ask your question.
Since my surgery, I started having a lot of joint issues and problems, and because can't use the NSAIDs and a lot of the anti-inflammatories and that because of the surgery, I was put on some methotrexate injections once a week. How does that affect having the surgery and medications or anything that go with that? Are there things I should stay away from, worry about, take?
So methotrexate itself, after surgery, as long as there is a window period before surgery and after surgery that we would hold it, because methotrexate is what we call anti-metabolite that stops healing. So clearly you need to go into surgery with the capacity to heal. But once you're past that healing phase and you're in a safe zone, it's perfectly fine to restart the methotrexate once again. Absolutely no problems, no contraindications. Once in a blue moon, I'll see patients who just cannot come off their methotrexate at all, and their rheumatoid arthritis flares up so badly, and usually we can have a discussion with the rheumatologist to suggest alternative medications that can keep their rheumatoid symptoms under control, even if it means keeping them on the methotrexate for surgery. In terms of pain medication, a couple of things. Usually, Tylenol is pretty safe. That goes without saying, and it works well for a lot of joint problems, anything to do with the bone. If you have to have something that belongs to the NSAID class, like ibuprofen, Aleve, any of those things, Mobec, then we really have to make a determination based on your history, because some people have just flown through surgery, never ever have had a problem with the gastric, the ulcer problem or gastritis, nothing like that. And they may be relatively safer candidates to go back on NSAID as compared to someone who's had, bleeding ulcer twice, even before their surgery. For them to go back on this class of medication may be more of a health risk. So it really is individualized, but it's not an absolute contraindication. It's a relative contraindication, those classes of drugs to start with, but we can certainly work with each patient based on their individual history.
Yeah, it was two years out when I started the injections just recently, about 6, 8 weeks ago. And I guess I was just worried about if that's going to affect.
Oh, no.
That has an effect on the weight.
You are long healed
Nothing
from
to
the
worry about
original
there.
surgery itself, and that should not have any impact on the surgery from 2 years ago.
Okay.
It's got its own set of problems that come into play. No medication is risk-free. And if you have any side effects pertaining to it, that's independent of the surgery itself, but it won't interplay with the surgery.
Okay, that was the question. Thank you.
If you've had a C-section and hernia surgery, can you still have plastic surgery for the apron? Dr. Bennett?
Absolutely, and I actually do recommend you have it, because once we remove the apron, the scar from the C-section will be gone. When we do the abdominoplasty, we try to incorporate all the possible scars that you have pre-existing, because we want a fresh, brand new, hairline scar that will hopefully be hidden very nicely in your bikini.
That's the apron.
The apron is just a very large pannus that hangs in the front. Depends on how much weight you lose.
It's the skin in the front that kind of hangs down. Thank you. Beautiful.
So we've all heard before that birth controls can cause weight gain. What are some of for those of us that aren't looking for fertility after surgery, to prevent weight gain with birth control and also be the most effective at preventing pregnancy? Like, I've been on the depot shop for over 10 years. Is that going to slow down my weight loss with surgery?
So it does. So you're talking about the role of oral contraceptives in weight gain, and is there a part to the question that what if someone wants to become pregnant?
Well, I don't. And I've been on the depot shop for such a long time, and it being a hormonal-based birth control, is that going to slow my weight loss over time?
Certainly, hormonal-based contraceptives, it's all just a spectrum. None of those come free. It's just a question of lesser weight gain or water retention versus more on the other end of the spectrum. But all the oral contraceptives that you have that undesirable side effect to some extent. If you want contraception without those effects, then really the best way to go forward is the intrauterine device. Those are long-lasting depending on which one you choose. Typically, it stays in place for easily 10 years. They are effective before they need to be changed again, if ever. And those are the ones with the minimal impact on your endocrine milieu of your own body.
How do you start losing again after you have gained? Megan.
Well, you make an appointment with your dietitian. No, I'm just kidding.
No,
That
she's
would
not.
help, absolutely. But I say it's back to basics. Go back to the basics, look at what you're doing, start logging your foods. Very important. Even as dietitians, when we start logging our foods, we're more aware of what we're actually doing, what we're actually putting in. That really helps. So start there. If you find that, okay, it's not what I'm eating well and something else is going on, then you need to see your PCP, or Dr. Stalin, or your surgeon, whoever that might be, just to make sure that there's not something else going on. So go back to basics first, make sure you're taking your vitamins, make sure that you're drinking enough fluids, you're getting enough protein, you're watching your portion sizes. If you need help with that, then yeah, the support groups are very helpful with that, or coming to see me or another dietitian. And shameless plug, I just want to let everyone know, we've got some people from here from Tawas and Standish and all over, but the dietitians who work in our Standish Hospital and the Tawas St. Joseph Hospital now are seeing our bariatric patients. So those of you who felt like you had to come all the way to Saginaw